Good morning, Peter Goertz. I'm a psychiatrist. Let's talk about bipolar disorder. This past week, I saw a young gentleman who looked like he had bipolar disorder. And what really made me think about talking about this today is how difficult people's lives can get if they have bipolar disorder. So the diagnosis, like many diagnoses in psychiatry, is not based on really tangible science. So there are a lot of gray areas. And the bottom line, I think, to remember is each individual is different. We may classify them as having bipolar disorder, but each person is different. And anybody can have bipolar disorder. For example, I used to work with a psychiatrist, a very good psychiatrist, and at one point he was hospitalized in the same hospital where we both worked for bipolar disorder. 2 months later, he was back at work, and he was an excellent psychiatrist. And I think because he had that issue of bipolar disorder, he was able to be an even better psychiatrist. So like I've been saying, everything has a silver lining. So the features of bipolar disorder are depression, and features otherwise can include of the depression, anhedonia, which is lack of joy in activities, lack of pleasure. Then people can have weight issues, low appetite, lose weight. Increased weight is also a possibility. Sleep is an issue. People can sleep less, more. There can be changes in energy, so people can really have difficulty getting up out of a chair and becoming active during the day. And there can be a general fatigue throughout the day in people with depression. And of course, they can have suicidal thoughts. And they can have concentration difficulties, feelings of worthlessness. Features of mania or hypomania would be grandiose behavior, grandiose thinking, schemes like I'm going to start 3 businesses at the same time. And again, sleep issues. Usually in manic or hypomanic episodes, people sleep quite a bit less. They can tend to talk more, so increased speech, increased rate of speech, flight of ideas, so ideas just keep coming. They can be distractible, and they can have increased activity. So these people are often on the go. They need very little sleep. So let's say a few hours a night, maybe even 3 or 4 hours a night. And they're good, and they're very active, and they don't feel tired even after a few hours of sleep. And things to exclude if we think someone has bipolar disorder, for example, a depressive or a manic or hypomanic episode would be, are these episodes due to drugs or medications, which both can happen? So let's say drugs like methamphetamine might cause an episode of mania or what looks like an episode of mania. Prescribed medication like a steroid might cause that. And medical issues, physical issues can cause changes in mood like depression, for instance, low thyroid function, or medical issues can also cause manic type behavior. So to give you a flavor, when someone is in a manic episode, they can feel invincible, they can spend money like there's no tomorrow, they can have sex with strangers, and what could happen, as an example, is someone wakes up in the morning in a manic episode and believes they had a dream about running in the street naked. And then that morning they talk to their friend, and the friend says that was not a dream. So they can really have behavior that can be quite difficult for society to tolerate, let's put it that way. They can be very irritable, get into fights, and then maybe even sustain head trauma, which can then cause additional problems. They take a lot of risks. They can be quite caustic, so if they talk with you, they may pinpoint some of your vulnerabilities and really push those buttons, and they can get psychotic. So people with mania can get psychotic. So, as you can imagine, that type of picture can be devastating to someone's marriage, to their family in general, to their children, and their work performance can suffer, even though temporarily, if they're in a manic episode, they can be very productive. But if it's getting more and more extreme, or even if they get psychotic, that can really then interfere with their work. Their physical health may suffer because of the risks they take, unprotected sex, using drugs maybe during a manic episode. In depression, also, their functioning can be really impaired, personal functioning at work. They can have suicidal thoughts, they can commit suicide, and in fact, in bipolar disorder, there's quite a high lifetime rate of suicide. And in depression also, in a depressive episode, they can become psychotic. So bottom line, what I'm trying to bring across here is this disorder is not to be taken lightly. These patients really suffer. At first, in a manic episode, or on the surface, they may seem like they're enthusiastic, they're enjoying their life, but if it gets above a certain threshold, then they start really creating problems for others and for themselves, and they really suffer. And then they can have enormous regrets after a manic episode. They cheated on their wife, they spent all their savings, the wife wants to divorce them maybe. So a manic episode can be devastating, and the same with a depressive episode. They might kill themselves even. So this problem can be very difficult for people to deal with in their lives. And medication generally is necessary. So I'm not going to exclude the possibility that rarely patients can deal with bipolar disorder on their own without medication. I don't think I've seen that, but anything's possible. And again, the diagnosis is not something that's cut and dried necessarily, and each individual is different. And it depends on a lot of other aspects also, how they do, their level of support in the community, if they have family who's supportive, that can help a lot. But in general, really medication can help. And choices might be lithium, Depakote, second generation antipsychotics like Abilify, and of course, any of those medicines that we give for bipolar disorder, like any medication, they can have side effects which may be quite serious, like the second generation antipsychotics can cause tardive dyskinesia. So movements like twitching that may or may not go away. So very serious side effects potentially. But the issue itself, the bipolar disorder, is very serious itself. So really, in my opinion, medications can be very helpful for bipolar disorder. And for me, it's difficult to understand that some psychiatrists are totally against medication, because this is an example, in my opinion, where medications can really help and generally, in my opinion, are necessary. Again, I'm not going to exclude individual patients potentially getting through these episodes without medication. Psychotherapy can help quite a bit. It's not something necessarily that is going to, on its own, be helpful, but it definitely can help. And basic issues, basic care, basic psychosocial stability can help quite a bit. So we want to minimize stress in these people's lives. It's easy to say, of course, if they don't have money, don't have a job, if their wife wants to divorce them. But if possible, we want to minimize stress as much as possible. We want to really have them sleep regularly, eat a balanced diet, stay away from alcohol and drugs. All this, of course, is easy to say. And even caffeine might interfere with sleep. So we want to be careful overall and make sure that as much as possible they attend to their basic needs, sleep, eating in a good way. And like I mentioned, social support can be a major help. Thank you.